Call, as already stated since yesterday. First and foremost, ladies and gentlemen, allow me the opportunity to extend our heartfelt greetings from the people of the Republic of Botswana, and needless to say, from my own staff, from the Ministry of Health. Director of Ceremonies, Madam, distinguished guests, ladies and gentlemen, it is my singular pleasure that Botswana has been invited to this auspicious occasion in India, an occasion that, amongst all, continues to cement our long-time partnership with the people of India. Botswana has made significant progress since 1996, when it gained independence to reach the level of upper middle income status. Over the years, our healthcare system has grown from strength to strength, with primary healthcare as the cornerstone of the system. As a result, Botswana, until recently, was amongst the best performing developing countries in health outcomes and human development indices. Our government further invested in healthcare infrastructure by building healthcare facilities of different capacities from primary to tertiary, delivering healthcare services at different levels of care, and in some places, putting up the state-of-art facilities. These developments have resulted in healthcare services being accessible locally even in our remotest and disadvantaged communities. It is also worth recognizing, on the other hand, that the private health sector has grown significantly, resulting in middle and upper income families accessing care privately and reducing healthcare costs to government and congestion in public facilities. Ladies and gentlemen, Botswana is now in the process of thinking ahead and addressing the next phase that will transform and expand our economy throughout the 21st century. A shift that is guided by fairly recent access to technology, communication capabilities, and globalization. Botswana has also made strides in health and education, evidenced by our far-sighted investments in medical education and academic medicine. After intense planning, we have established our very first medical school and built a 450-bed quaternary care teaching hospital, which will provide practical and clinical training for the undergraduate and postgraduate students, and house centers of excellence providing specialized high-end care. According to the global corruption watchdog, the Transparency International, Botswana is ranked the least corrupt nation of all 54 African countries. Through the economic diversification drive and hubs creation, we are stepping up our competitiveness to diversify the economy and improve the livelihood of our people by investing in healthcare and commodities production in a view to access regional markets. However, just like any developing country, Botswana is experiencing challenges due to the burden of non-communicable diseases, their associated disabilities, and premature deaths. These challenges are trained personnel. Botswana faces a major challenge in recruiting and retaining the appropriately qualified personnel for non-communicable diseases, both at clinical and public health level. Training of available staff is also recognized to be essential for sustainability of programs at local level. Technology and equipment. The capacity to screen and effectively treat many of the NCDs within the country remains inadequate. Sustained funding. While the country has enjoyed the generosity of partners with regards to HIV/AIDS, the same has not been the case with NCDs. No data exists to fully cost the burden to which NCD has to the health budget, but evidence exists to show that it remains the major consumer of the health budget given its increased prevalence. Sustained supply chain and essential drugs. Constant drug interruptions at local level remain a major challenge in the control of NCDs, which is multifaceted. Lack of systematic logistic management, technology, equipment, trained manpower is but one of the critical issues resulting in poor drug supply at national level. However, the inability to produce generic drugs of high potency locally remains a challenge. Certainly not only for Botswana, but for most of the developing countries. Diagnostic capacity and treatment. We continue to experience lack of specialized diagnostic and treatment technologies and skills, coupled with lack of specialized facilities such as those for surgeries, including organ transplant. Director of Ceremonies. Due to this reason, Botswana has embarked on all initiatives geared towards the prevention and control of non-communicable diseases. The country is currently addressing the issues of NCDs through the following: strengthening of national policy, plans and surveillance of risk factors, primary prevention and management at primary health care level, setting up NCD centers of excellence to prevent and manage complications and harness modern technologies, including skills building. Leveraging on partnership, both development and bilateral partners, academia and private sector, such as Apollo Group of hospitals. It is my understanding that Botswana is in the process of sending the first kidney transplant patients to India, a momentous occasion indeed. It is our hope that through partnerships we will make advancement in healthcare and subsequently end up saving our people from most of these debilitating illnesses. And that being the case, ladies and gentlemen, I wish herein to conclude my short address and wish to take the opportunity again to wish you the best in all our deliberations in this conference. Thank you very much.